Hello Peter, are you ready for me to do your medication now? I just need to give it down this line. Thank you. Okay, remember what we did before, which was you just sat nice and still, we check through the medication, make sure it's all right, make sure you're happy with everything, then we slowly give you some medication down this line. I see your feeder's finished, so I'm just going to clamp that off. So here we are, just clamping that off there. We'll take that down after we've given you medication and flushed the line. First thing I need to do is just take some water from our jug of water here. It's quite warm, or it's not warm. It's been boiled. It's cool, so it's just room temperature. So just going to check how you are and check around your site. Feel okay? No problems around the tummy? Okay, thank you. Okay. So I'm just going to check around the site. No problems there, no pain? No. Okay, fantastic. Now I have washed my hands and I put a pair of gloves on. Normally I would wear a mask, but just because I'm demonstrating, I'm not going to wear a mask today. Okay, so the mask is out of the way. So I've got the medication and everything ready for you. So I've checked over the site. My sleeves are nicely rolled up, so I'm not going to get any of my clothing in the way. So here's the point where I'm going to administer the medication. So I'm going to take the connector out, or the bung out. I'm going to connect my flush line in, and I'm just going to, and that's clamped off. That clamp is open, and I'm going to slowly administer, just so it doesn't make you jump. Okay, so there's a nice few mils. So we may give a larger amount depending on what's been advised. Okay, so what you can use this clamp for is to clamp off in between, just so nothing comes back up the line. Take your medication, take your line. Do a little bit of pretending now, so I'm just going to fill that up again, ready for flushing afterwards. Here's your medication that I'm going to give you. It looks evil looking stuff, but it's nice B12 vitamins for you. And you can see that going in. And what actually I've noticed there, I haven't taken the clamp off, so and because it's clamped up here, it can't go anywhere. So take that clamp off. Slowly that goes in, and because I'm giving this darker looking stuff, you can see it's going in, and it's trying to go back up the line here to the giving set, to the pump, but it's not going to let you do it. This is kind of the thickest medication we're going to really give. I'm going to clamp that off again, disconnect, put that to one side and go back with a flush. Unclamp, and what you'll see is the line will clear. Now if you need to repeat that process a couple of times, then what you'll realise is that you're going to get through a few syringes, but it's one syringe for everyone. You don't just mix everything up in one cup and give it all in one go. So we need to make sure that we give it as each separate medication and flush in between. The amount of flush you give in between, really a lot of things depend on it. Medication might be an issue. What you see from here is that where I've flushed, if you look, there's still some residue of the thick stuff in the line. Okay, I don't know whether you can see that clearly. Let me put that on here. There's still some residue in the line there, which tells you that there's some things do cling on a little bit. So I'm going to show you as a technique. Pay attention to this, Peter. I'm going to show you a technique which will help reduce the risk of this line clogging up again. So just connect that up there for a little while. Draw up another 20 mils. Connect up. Okay, this technique is called push-pause. So we push and we pause, as the name suggests. So we go push, pause, push, pause, push, pause, push, pause, push, pause. Clamp it off temporarily. What that does is it causes a bit of turbulence in the line, and that stops things kind of aggregating, sticking together. Connect back up here. Now if you've finished feeding, you can take the feed down. Now pop your bung back in undo the clamp, and that line is now locked. We call it locked. And as you might be able to see, actually the liquid I've put in there is you can possibly just see the liquid in that line. The water in that line is actually all that's in that line. So I've flushed through all that medication, all that sticky stuff has gone through, and the line is now ready to go. For this tube, you don't need to do any rotating. Rotation is something that's unique to PEG tubes, percutaneous endoscopic gastrostomy tubes, and I'm not going to do that one today. Okay, I'm going to leave that at that, and over to you really to demonstrate that.